That's a good start. Okay, we'll make a start. If people can keep on mute until the discussion session, and then I'll call you in at that point. So thank you very much for joining us on tonight's Hazards Campaign Thursday talk, Fighting Our Corners. My name is Janet Newsham, and I am the chair of the National Hazards Campaign. It's an organisation which is UK-wide network of resource centres and campaigners to support those organising and campaigning for justice and safety at work. The UK has one of the highest infection rates in the world, one of the highest death rates in the world. Over 1 million people, including children, suffering from long COVID, and we've got a government that's dithering about reinstating public health controls, and that it should never have dropped. And an NHS teetering on the edge of destruction with a capacity, staff and privatisation crisis. So we've got massive challenges facing the country, but facing reps in particular, those safety reps that have been fighting all the way through the pandemic to save lives and to keep workers safe. And we're joined tonight by some fantastic, brilliant, inspirational speakers. And I'm so pleased to introduce them. We have Tracy Edwards, who's the National Health and Safety Officer for PCS. We have Hilda Palmer, who's from the Hazards Campaign, from Greater Manchester Hazard Centre and for Families Against Corporate Killers. We've got James Robertson from Unison Knowsley, Branch Secretary, and Cray, the Health and Safety Rep for RMT at London Underground. So fantastic experience and knowledge, and I'm sure they're going to be inspiring to you all. And I'm going to give each speaker about 5 to 10 minutes to address you, and then we'll open it up for discussion and questions and answers, because we want to make sure that it's an interactive session, that it's not just about people talking at you. And I'd ask you, if you can, that you raise your electronic hands if you want to speak, but we'll take the questions and the discussion at the end, if that's okay. So without further ado, then our first speaker is Hilda Palmer. And Hilda, if you've has had a lifelong
she's had a life. Just leave it there.
A lifelong campaigner of health and safety. Absolutely fantastic work in keeping workers safe and providing the knowledge and expertise that she has, and sharing that. And through the pandemic, she's really become an expert in ventilation, and she's worked with many unions to try and help them understand what's needed on ventilation. But she is obviously an expert in lots of different subjects and topics that keep you safe in work. So without further ado, over to Hilda.
Thank you ever so much, Janet. And thank you to Janet and everybody else, all the illustrious people who are speaking tonight, including Janet. Okay, Janet's asked us to talk about priorities in keeping people safe from COVID at the moment. And I mean, I wish I could say I had lots of silver bullets, but I don't, because basically we're still in the same fight we've always been in, which is fighting our corner, fighting for our lives and our health and our safety at work, more than ever now. We're in a very, very, very difficult situation. But the biggest priority we have to face is preventing transmission. That has to be our biggest priority at work and everywhere. Vaccination never was going to be a silver bullet, and relying on vaccinations and nothing else and letting transmission ratchet up, as Janet has said, has been an absolute disaster. Vaccinations only work to reduce severe illness, hospitalizations and deaths, but not infection and not transmission, and also not even severe illness and some deaths. The rate of infection at the moment is through the roof. We have over 100 deaths every day. A couple of days it's been nearly 300, 500,000, 50,000 cases a day. And we need to prevent transmission, because we need to prevent anyone from becoming ill. We don't know what will happen if somebody becomes ill, how serious it will be. We don't know if they'll go on to develop long COVID. We don't know how many people are specifically vulnerable, clinically extremely vulnerable or clinically vulnerable. And we have to prevent the pressure on the NHS and on all our essential services, because COVID is really an individual and collective health, social and economic disaster. Right, I'm going to talk very practically about what we must do, which is to prevent transmission. COVID is airborne, so therefore ventilation, filtration, source control masks, distancing, fewer people for less time indoors, all of these multiple factors, multiple preventions are absolutely essential. 1 in 12 secondary school children is infected, 1 in 60 of the general population. That means that wherever you are, on a bus, in a shop, at work, at school, you are going to be in the presence of people who are infected. And we have to try and stop that infection spreading. Infected people exhale big droplets and tiny aerosols. The big droplets fall to the ground within 2 or 3 meters. Ventilation doesn't affect them. And they'll only infect you if you're very close by and the drops happen to fall on your eyes, the entrance to your nose or your mouth. And if they do that, they generally won't cause a terribly severe illness. But the tiny aerosols, the tiny particles, which may be packed with COVID, if you inhale them deeply into your lungs, and the more you inhale, the more severe illness and infection you will have. And that is what we're trying to prevent. But obviously, keeping your distance is very, very important. If you are 2 to 3 meters away from people, you will prevent being touched by droplets, and you will prevent inhaling that dense concentration of small aerosols. But those smaller aerosols can also be carried by air currents. They're very tiny, they're millionths of a meter in diameter, and they're carried by air currents throughout the space that you're in. They're carried like smoke, and they can hang in the air and linger for hours after someone has passed through. And they can travel, a very long way. And they can be inhaled by someone who's meters away from you, or someone who comes into the space after someone who's infected has passed by. And that's important for stairs, lifts, toilets, and all the rest of it. So we've got to reduce that viral load in the air. And the first way we do that is to make sure that we try and keep people who are infected, the positive cases and contacts, out of the workplace. And that involves test tracking and isolating, supporting people economically, making sure that they have sick pay and all the rest of it, and keeping people at home. The next way of doing it is by making sure that everybody in an indoor space is wearing source control masks. They're not PPE, they're source control. They catch the droplets so they don't get out into the air, so no one can be infected by your droplets. They catch at least 50% of the aerosols, more if they are very good fit and very good filtration. So they prevent the infected aerosols and droplets getting into the air. Fluid resistant surgical masks are probably the worst. They don't do this very well at all. So those source control masks are part of the collective protection, collective control measures. Then there's ventilation. A good flow of air will dilute and remove the aerosols and reduce the risk of inhalation. Pre-COVID, ventilation in all our workplaces, and especially schools and offices, was very, very poor. And that has caused us lots of problems during COVID. But what do we need? We need to find out what the ventilation is. Do we have a proper heating, ventilation and air conditioning system? Or as in 80% of schools and loads of offices, do we just have windows and doors and holes in the wall? Your employer must have competent people who can tell you what the ventilation flow is. You need to ask them, and they need to be able to tell you this. Saying it's fine, just open a window is not giving you that information. And the information you get, you can then feed into the risk assessments and the control measures. Pre-COVID, the welfare regulations guidance said that people must have 5 to 8 litres of fresh outdoor purified air per person per second. Now, under COVID, the HSE guidance on their website refers to CIBSE, the Chartered Institute of Building and Service Engineers, and their recommendation during COVID is that ventilation should be at least 10 litres per person per second. That's very, very important. Sometimes you'll see it expressed as air changes an hour. And the recommendation from WHO, from WHO, is that we have 6 air changes of hour in all workplaces. And what does that mean? That, well, if you only have 1 air change an hour, it would take 3 hours to clear the air of any aerosols. If you have 6 air changes an hour, it only take 30 minutes. So you can see that generally, as far as ventilation goes, The more the better. But we have to be aware of thermal comfort, and we have to be aware, of course, that winter is coming again. Measuring ventilation is difficult, but somebody should be able to do that or should be able to tell you. But there are various modeling tools, and if you look at the information I've put in the chat, you can find those access to those tools. The British Occupational Hygiene Society tool is quite simple. You just put lots of data in and it tells you what's likely to be the ventilation. But we can make ventilation visible by using CO2, carbon dioxide monitors. You breathe out carbon dioxide. If the ventilation is poor, the carbon dioxide builds up. The more that exhaled air that might contain COVID builds up, the more carbon dioxide there is, the worse it is. So you can have a CO2 monitor and you can actually measure it. And what are we actually looking for? Well, basically, experts say that if you have 10 litres per person per second of good air, then that will keep the CO2 level below 800 parts per million. And that is the level we use. The HSE accepts that that's a good level for indicating a relatively well ventilated room. And that's what we should be trying to do. So lots of teachers and lots of workers have actually managed to force their employers to buy CO2 monitors and are using these. They don't make the ventilation better, they help you measure it, and they help you then work out what you should do about it. But if you can't improve the ventilation, what do you do then? Well, the next thing that can be done is to use HEPA, or HEPA filtration. That means high energy particulate air filters. And they're just filters that are guaranteed to filter out very, very small particles, including all the ones that we're worried about. And they do this to a very high standard. And you can buy standalone sort of boxes with HEPA filters and a fan, and they suck the dirty air out of a room, filter it through these high energy filters and put cleaner air back into the room. And in this way, they can supplement the ventilation and reduce the risk of inhaling air that contains COVID. Avoid anything that says it's a purifier, that adds ozone, that has ultraviolet light, that adds hydrogen peroxide, that any other sort of system. You just want HEPA filtration. You don't want to make the situation any worse. And then, because none of these things will work perfectly, you need to add PPE. All healthcare workers, all social care workers, and many other workers, teachers especially, should be wearing PPE to a high level. Personal protective equipment, respiratory personal protective equipment to FFP2 or FFP3 standard, because that will protect you. It's not source control, but it will do that as well, but it will protect you. And that is what we must be doing. And that will help to filter out the short range and the long range aerosols. So we must do all of those things, that so-called Swiss cheese method of multiple prevention, layered preventions, which will protect us all. And as safety reps, we have to fight for all of these, challenge our employers, and we have to also fight the government to bring back mandatory protections and preventions. Otherwise, everything is going to get even more out of control than it is at the moment, but it is already out of control. Thanks very much.
Thank you so much, Hilda. That was excellent and really good advice. Explained, simply to people as the sorts of things that you need in workplaces. Can I just welcome those colleagues from Ireland that have been posted in the chat, and Arizona. It's lovely to see people from other countries and other places to support the event. Our next speaker is Kat, and Kat's a health and safety rep on the London Underground and has done fantastic work during the pandemic. And so our next speaker is Kat Cray. Over to you, Kat.
Good evening, everyone. Thanks for having me. Yeah, I'll just give you a little description of what I do, because we've all got all sorts of names for things in the trade union movement. So I'm a tier 2 rep, so that means I'm on full-time release. And me and 3 other colleagues have responsibility for all station staff on London Underground. We obviously work with a fantastic array of local tier 1 reps, which I also am on the north end of the Metropolitan line. So I'm just going to speak a little bit about what we still have in place, what we're fighting to keep in place, and what we think we're going to come up against come the winter. So obviously the most significant change nationally was in legislation in July 19th, in which with a bit of political pressure, the Mayor Sadiq Khan retains face masks as being mandatory when you're on the tube, as he has ownership of TfL bylaws. But the context of that happens within a political argument between the government and TfL on funding. And what we've seen since July, very unsurprisingly, is that mask compliance has slid down and down and down, because people can jump on a national rail train and it's not mandatory, even though it's encouraged, and then they can jump on the tube. And they're not really, however many posters we put up, that consistency, that level of mask wearing is getting less and less and less and less. But what we have retained and what did not change in July were all of the measures that we argued for throughout the pandemic for staff, for which we can have some say over. So those things included social distancing, max occupancy of all staff areas, all backroom areas, all control rooms, and retaining those areas on a gate line when you're in a tube station, where staff can have a little bit of space for the 2 metre by 2 metre away from the public as they pass through the gate line. You know, those areas that have carried the most significant risk are staff who are static. And if you're given a gate line duty for several hours, you are stood on a gate line watching people pass through a gate line. And one of the other biggest challenges we faced is back in lockdown, when our footfall on London Underground was about 3%, and it crawled up to 5%, and it crawled up to 7%, up to 9%. And we're now in the late 50s, up to about 60%. There's a significant amount more people using London Underground. And on top of that, we've also had the return of large footballing events. So we have several large stadiums, not just Wembley in London, at which you're looking at crowd capacities of anything from 5, 10, 15 to 20,000, and at Wembley 90,000. So what we weren't dealing with really pre-July, other than the Euros, which were an absolute nightmare, are large crowds of people. And going into winter, they have announced there won't be the fireworks, and that won't happen, but we will be having Winter Wonderland, which could see up to 60,000 people a day in 30,000 sessions. So basically a sort of day, morning, afternoon, and then an evening session. So we're facing the challenges of these events, along with the sort of cultural urgency for people to do things they didn't do a year ago, people that didn't feel that they had a Christmas, people that didn't have a Christmas work do, people that couldn't get out shopping on Oxford Street. So I think what we're anticipating coming into winter are people wanting to do things that they felt restrained from doing last year. And one of the biggest challenges are large crowds. Now, even without COVID, all London Underground stations have congestion control and emergency planning. So ways we can slow down or speed up the flow of passengers in and out of a station. And they remain incredibly important documents. And if they're changed, the rep has to be consulted. So the local reps have played a really, really key part in ensuring that our congestion control and emergency planning is bearing in mind an airborne disease. Now, our employer will only supply us with type 2R surgical masks, even though we've been asking for FFP2s, FFP3s, and even N95s since the start of the pandemic, although as you'll find, many staff do wear their own. I wear an N95 when I travel. And as Hilda quite rightly pointed out, the issue of ventilation remains absolutely critical. And the tube is a very vast, complex network, and some of it is deep level, which means it has the least access to fresh air. But going into winter at stations that are above ground, which is 2/3 of London Underground, we have the issue of comfort and being warm enough. So if the ventilation provided in an area was an open window at 4:30 a.m. on an early shift in December, that's not going to be pleasant or comfortable or good for your health, safety and well-being. So I think our eyes are really on focusing on, again, making sure the ventilation in all of the rooms is safe and adequate, bearing in mind the season, and also the yearly task of ensuring the right maintenance has been done. So you don't go to switch something on that hasn't been switched on since last year to find that it's not working. And the challenge with that is with cuts and changes coming our way, we find that certain maintenance regimes have been reduced. I'll give you an example. I submitted an FOI last month. I'd submitted exactly the same one the year before, asking for the same data. I was just asking for the data for 2020 on unstaffed stations, and they denied that FOI by saying because of a restructuring, there was nobody doing that work anymore. So we do have an issue of transparency on finding out the data on what actually is going on across a vast and complex network. But I just want to end by saying the local reps that I have the immense pleasure of dealing with are absolute legends. They pick up everything. They jump on it in a second. They work as a community together. And when we have incidents like we've had this week, like we have every day, we meet together. We organise in various ways, WhatsApp groups, over the phone, online Zoom meetings, and obviously we have our physical branch meetings that we attend that were online until July, and now we're trying out hybrid ways of doing it. But I think that what we've all come out with is we know each other 100 times better than we did pre-COVID. We've worked so closely together and gone through such difficult, complex circumstances. Many of us have had COVID, have been really ill with COVID. Many of us have lost loved ones to COVID. Many of us, you know, some reps I work with at Wembley worked all the way through those Euros events when there was just thousands and thousands of people piling through Wembley without a mask. The mask compliance was practically zero for the Euro finals. But I just want to applaud them. Without them, we would be nowhere. And my final point being that I think the thing we found the most helpful, and we continue to find the most helpful, is to get communication out there as quickly and clearly and simply as possible. So we began writing bulletins, of which I think we've racked up over 150 over COVID, which are aimed for local reps, but that can be shared with members so that everybody can see where we're at and what's going on. And we found that to be something that we probably should have done a very, very long time ago, but something that has been very beneficial for local reps and for our members.
Thank you so much, Kat. That's really inspiring what you're doing there. And you know, as you quite rightly said, you know, we're quite rightly indicated, that we know that we're twice as safe where there's an organised trade union present in our workplaces, and that's essential. And the sorts of actions that you've been taking shows why that happens, because because of the fantastic work that you're doing. And yeah, I echo the applaud that you give your reps, but to all safety reps. That's really, really important. But yeah, thank you very much for that. And we're going to move on to our next speaker, who is James Robertson. James is the branch secretary of Knowsley Unison branch, and I know they've done some fantastic work at Knowsley in trying to hold the employers that they represent, of the members where they represent, to account. And hopefully he's going to tell us a bit about what he's been doing and what the branch has been doing. Thanks, James.
Yeah, thanks, Janet, and thanks for the invite today. And it was great to hear from Hilda, as always, and it was really inspiring to listen to Kat as well, and the work that their branch has been doing. So when I was asked to speak at this tonight, it was a bit like, where do I start? You know, just thinking how much has been done by the branch in the last 18 months. And I remembered right back at the beginning and the conversations that we were having with senior leadership teams and head teachers. So if I just explain, like Kat did, in terms of my role. So I am the branch secretary of Knowsley local government branch. So we look after all of the council workers, 63 schools in Knowsley, the housing associations, and we've got a growing number of private sector care agencies and private sector private day nurseries as well. So there's quite a huge range of areas that we look after, and each conversation with each senior manager was different. But what proved invaluable was this book and I don't know whether you can see it there, but it's the brown book anyway. If you don't know it, you should know it. It's the Safety Reps and Safety Committee legislation, as I refer to it as the brown book. And I took much delight in educating the head teachers mainly, but as well as senior managers across Knowsley in the rights that they had to afford us in terms of our trade union. And at first, we got quite a bit of kickback on it, particularly from head teachers. It was like, no, this is our school. We only involve the trade union if there's an issue. Why are you contacting me asking for a risk assessment? Fast forward 18 months, they're now contacting me before I contacted them and say, I need to update my risk assessment, James. Who's the school rep for us? Is it you I'm speaking to today? Because we need to change something. I know we need to run past it. Have you got any advice? And the culture change in the last 18 months has been really positive, and we got some really positive comments from both management, the trade union, and the members side as well. One of the things as well that I was very keen to engage from the start in this was that the trade unions wouldn't be seen as a third wheel in all of this. So management, senior management or head teachers wouldn't see us as we're sitting somewhere over there. It was like, no, we're the staff representatives, and therefore the staff must be consulted as well. So if you're sharing a risk assessment with us, you're sharing it with all of the staff. So we used our methods of consultation, using our online systems to share everything that we were being consulted on, whether it was a risk assessment or whether it was an HR policy that would go to every member of the branch before we went back into the management meeting. I'll come on to some of this in a little bit, but we sometimes felt we needed to ballot as well and ask the question, would you be prepared to take action over this before we went in to the management meetings? I know that's something the RMT do a lot of, and particularly the late Bob Crow, and take a lot from him in that respect. And there is plenty of time to do a consultation ballot before you even enter the first negotiation. I think it's a good indicator to where your strength starts. So I'll just come on to some of the things. So that was around the education for everyone. In terms of, if I just leave COVID aside for a second, in terms of some of the health and safety work, I think it's important that as trade unions, we don't forget that there is the bread and butter side of the trade union in terms of your casework, but also your collective bargaining arrangements must be maintained while we're dealing with this high-pressured issues that we're facing with in terms of the safety. And I was keen to ensure that the other safety measures and policies didn't go by the wayside in Knowsley, and we were just getting to the point of not just setting up a proper full functioning joint health and safety committee, but also setting up the subgroups as well and reviewing our health and safety policy. And at first it was like, how can we do that while we've got all this other stuff going on? But I just want to tell you it can be done, and we have done. And I just want to run through some of the things very quickly of what we've updated in Knowsley in the last 12 to 18 months while we had everything else going on. So we've introduced a new online instant reporting system, which is now fully functional and used across the areas. And then we've reviewed and updated all of the following policies: asbestos policy, chemicals in the workplace, construction, dangerous substances, display screen equipment, electricity at work, fire risk assessment, first aid, Legionella, lone work and manual handling, new and expected mothers, noise at work, risk assessment guidance for management, and safety reps and consultation guidance. All of that done in the last 18 months on top of the COVID work. Now, just conscious of time, so I'll move through some of this a bit quicker now. But coming to COVID-19 and dealing with that, yeah, it was new to us all at the start. How could we contend with this? And we set up very early on with the main employer, Knowsley Council, weekly COVID meetings with the most senior management round the table, round the virtual table, and all of the trade unions. And we'd flash out, you know, how we were going to respond. If you remember at the beginning, you know, I'd have BBC News on constantly because the guidance was changing so much. and you'd just get your policy finished or your guidance going out, and then you'd go and change it, wouldn't you, again overnight, and then you'd start again the next day. But just some of the policies that have came out of those weekly COVID meetings. Well, first of all, we were able to negotiate that any COVID-related sickness absence wouldn't be treated under our sickness absence scheme, and that anybody, no matter how long they'd worked for the authority, even if it was from day one, they would receive full pay for any COVID-related or non-COVID-related absence. But we went a step further than that. During the period of the whole of the lockdown, there wasn't a single sickness absence, no matter what it was related to, didn't count towards any trigger points. Everything, we managed to get everything discounted because it was the right thing to do. And that was only through our collective bargaining we were able to do that. We obviously went through and agreed additional policies for people who were high risk, and then it became CEV, and we were able to get those additional support and policies in place for those people, particularly if they worked in areas of the workforce where they were unable to work from home. Well, we immediately got a policy which secured them full pay, and they were shielding at home without the need to carry out work, and that was done under extended special leave agreements, which we were able to achieve. Another one we got was annual leave carryover. So usually you had a maximum of 5 days annual leave, which you could carry over. We negotiated to carry over all of the annual leave, but not just for 1 year or 2 years. We've got it for 3 years. So up until, I think it's actually up until the beginning of 2023, do we have to look at people being able to start to get that annual leave down if you've been unable to take it. And finally, one of the other policies we got was a proper redeployment procedure, so that people couldn't just be moved into jobs, because in the early days we had some issues with this, where they moved some of our neighbourhood section of the workforce into an area which they were untrained to do, and it led to an accident. So now if there was a redeployment request, it had to come through the trade union, and a panel of both trade union and management side would agree to that and make sure all the checks were in place, from the training, from the risk assessment, and ultimately did the member of staff feel comfortable in doing it, because it's not what they were contracted to do. So we were able to do that. So all sounds all great and all rosy, doesn't it, in Knowsley? But no, if it just touched on now some of the disputes and fighting we had along the way, for want of a better word, well, you'll all know about the national dispute that we had in schools over the Christmas period, and whether schools should open in January or not, and the threat of the Section 44 letters and the trade union legislation that we had to work through in that. You know, you couldn't be seen to organise, and we didn't organise, honestly, about the Section 44 letters, but we provided advice and guidance to every individual over their rights at work to withdraw their labour, to remove themselves to a point of safety should they feel at sudden and immediate risk in the workplace. And we were able to do that, and good on our staff in schools. A lot of them were forced to exercise their right on that one day that they opened up. And it was that show of solidarity, certainly not just in Knowsley, but across the country, which led to the government backtracking on that. And then the schools were shut, as they rightly should have been. Another issue we had, which is quite recent, is once the vaccination programme got underway, the council, in their great wisdom, came to us and said that they wanted to review the self-isolation policy, and that if anybody hadn't been double vaccinated, or they were under the age of 18, and they were, sorry, if they hadn't been double vaccinated, because the government guidance says they no longer have to self-isolate, if they hadn't been double vaccinated, which meant they did, they would be treated under the council sickness absence policy, and they would have their sickness pay entitlement affected. And we immediately launched into a dispute with them over that, because while we support vaccination, we don't believe in it being done through mandatory or force. It should be encouraged, and advice should be put out there, and conversations should be had as to reasons as to why people have been hesitant. So to punish one side of the workforce who may have found themselves in that situation, then we felt that was wrong to do. And it led to a pretty hostile dispute over 1 week, where we ended up in the local newspapers, the local Echo, BBC Radio Merseyside. I was at an interview with them, and even they were saying, "Is this a Labour council doing this?" And it was like, "Yeah, it is." Well, they silently backed it down on that. The week after, it was we're just under consultation over that, and we never heard from them again. But without the solidarity shown from our members in supporting us to take that action, then it certainly would have been changed overnight. And finally, I'll just finish on where we are today in terms of all the concerns that we've got because of the growing rates across the country, because of the concerns raised by the NHS, the scientists and other professionals, and you can just see for it yourself, can't you? I'm living in a household now where someone's tested positive on a PCR, unfortunately, but it's real. It's real. It's still, it never went away, but it is growing. So I'd written into the council management yesterday, which I thought was what would be quite reasonable request for the Labour authority, which was, I want you to not wait around for the government for their plan B and reintroduce the following mitigations immediately. And that is social distancing back again in the office environment, because that has fell by the wayside here already. Face coverings to be encouraged and used again across the workforce. And finally, for anyone who can homework, that they are placed back on home working for full time if that's what they wish to do. Because at the moment, they've asked our members to come in at least twice a week who are working from home, which is just beyond me. Now, I thought that was quite a reasonable request, and I thought it would have got a reasonable response. I haven't done. So only today, emails have gone back and forth between ourselves and senior management, where they are refusing. I felt like I was reading Javid's speech again when I read the response from management on this. However, we are consulting on it, and we've got an online consultation out, and 98% are currently backing Unison's view on this, and we may escalate this matter further. We may need to encourage our members for their rights on Section 44, and we will do that. And one thing that really gets them is social media. For some reason, they don't like it when our branch officers put on social media information that we're doing, and it's a tool that's often led to a response and led to a reaction. So you might see some interesting comments and information coming from the Knowsley Unison Twitter and Facebook pages over the next week. But I am hopeful we will get to a point that they will see sense, like they did with the self-isolation policy, and we'll get to exactly where we need to be in the interest of our members and the services themselves. Sorry if I've gone on a bit. I probably could have talked for a lot longer, but thanks for inviting me, and cheers.
Not at all. Thank you so much, James. That was excellent and really useful information that you've given us, and shows how important it is to challenge your employers to make sure that your members are safe. There's some fantastic work that you've been doing in the branch, you know, not just the health and safety work, but all the other work that you've continued to do throughout the pandemic. And I'm sure that this is, well, I think it proves that it's had an impact. The fact that they started by not really consulting you, and now that you are part of the consultation and they come to you. And I think that's my experience. That's our experience as safety reps, is that the more we're organised, the more we're putting demands on employers, the more that they will then respond and come back to us. So there's some really good information there, good examples. And that leads us nicely on to PCS and Tracy Edwards, who took up the mantle fantastically at the beginning of the pandemic, who was newly appointed into the health and safety role and has done some brilliant work across the union nationally, and supporting her members in all sorts of different organisations which has been really hard and difficult at times, not least in the DVLA. But over to you, Tracy. Thank you.
Thanks, Janet. You're too kind. But just to say, I mean, I'm a full-time officer of a trade union, and I have to take my hat off to every single workplace safety rep out there. All our safety reps in PCS have played a fantastic role, and have contributed towards making our workplaces safer. And no doubt saving lives. And one of the things that we've been doing all throughout the pandemic is getting our safety reps together in regular meetings, and it's been fantastic as well, because we've had outside speakers from other unions come in. We've had PCS speakers speaking at other events, and in terms of my ability to do my job, that's very crucial. To hear from to hear what's going on in the workplace, and that's vitally important. So I think that just to kind of go to the subject really in terms of what can safety reps do, I kind of had to think about this earlier, and I wanted to cover kind of 3 basic points, and I think the contributions that both James and Kat have given actually kind of emphasize those points. We've had nearly 2 years of the pandemic. The pandemic has brought the issue of health and safety to the fore, and actually, despite how difficult it's been, I think that we've also learned a lot. Kat mentioned that in her contribution in terms of how the safety reps have developed in terms of their relationships, and we really are seeing it's all coming together. So I think it's not going to be anytime soon. We're obviously heading into the winter, and who knows what's going to be taking place next year. I think it's safe to say that safety reps are and will continue to be essential to making our workplaces safe. And I think central to that was kind of 3 points that I wanted to draw, really, that based on the experience of our reps in PCS over the course of the past year or so. I think number 1 for us, I think that is to ensure that the trade union safety rep is firmly integrated as a trade union role, and firmly integrated into our branches. We can't return to the days where the sort of union safety rep was seen as a sort of add-on to the branch. It was sort of seen as something separate, or something that somebody who works with management to solve health and safety problems, although obviously sometimes that can be appropriate. I think that we have to make sure that role isn't separated out, and that we're not there to kind of find solutions for management, but we're firmly there to hold management to account. And of course, the beauty of it all, as James has pointed out, the trade union appointed health and safety rights have got statutory rights in law, although in recognised workplaces at least, and although employers might try and dodge those, no doubt we still have those. So that's the beauty in terms of being a trade union appointed safety rep. The second point I wanted to cover was about education and sort of developing our confidence. I think it's really important that as we can, safety reps can often, management can often try and bamboozle them with technical information and all of this sort of stuff, and we don't expect our safety reps to be technical experts on anything. However, we do, it is important that, safety reps are aware of what their rights are, and that safety reps, I think that Kat made the point about communication, that we can translate the health and safety issues into, non-technical language that's then communicated to members, because, we've had 18 months really of confusing, inadequate information and guidance from government and employers, and it's been down to the trade unions really to cut through all the crap, to spell it out, and to put it out there. I think a good example would be on the issue of ventilation, which Hilda is covered. In our experience in PCS, most employers don't, or they're just blindly refusing to understand the issues around ventilation. There's no enforcement action on them yet on that. And the attempt to tie our union reps down in technical speak in order to try and dodge their responsibilities. So it's important that we make sure that we are we're not sidelined by that. We're not kind of we don't lose confidence about that, because in my experience as well, many of the health and safety managers that we are dealing with don't actually know their stuff on health and safety. And then the third point I wanted to make, really, which is a point that we can all agree on, and it's a point that the hazards campaign in particular has been hammering home, is that we can have as much legislation and as many rights as we want, but if we don't build our membership, if we don't build the union in the workplace, then it's a paper tiger, really. And I think what we should be talking about here is talking about workers' control over our workplaces. I think that the fact that cases are continuing to rise, we're seeing alarming numbers going into the winter. There has been no proper track and trace system in this country. It's been an absolute disaster, an absolute failure. So it's going to be down to us in our workplaces to do that as well. And it's through collective action and the collective pressure that we see employers move. As an aside, our members working as driving examiners recently took part in a ballot for strike action. As you can imagine, massive backlogs in terms of driving tests, and rather than employing and training up more staff, they were expecting our members to take on extra tests. So increasing an already demanding workload of 7 tests a day, wanting to increase that to 8 tests a day. And our members responded with a 92% vote in favour to take strike action, which has now resulted in a partial victory, nonetheless, but an important one, where the DVSA have committed to not looking at that for another 12 months at least, and obviously the battle continues. But what this dispute as well is raising is also raising the vital issue around workplace fatigue and stress, which I think is going to be, is up there in terms of the number one hazard that's facing workers at this moment in time. We've got a collective trauma on our hands to deal with in terms of the decisions that the government has made, and of course the Tories' austerity agenda. And overall, I think things are not going to get any better anytime soon, especially in non-recognised workplaces. So it's important that we get recognition in those workplaces, and we've got the comprehensive spending review. PCS are looking forward to that, which is coming up imminently, and we are really preparing for announcements of further cuts. It's rumoured that Sunak is planning to cull all those jobs that had been created to deal with COVID and Brexit, and they think that once they can, once all that's over, when that'll be, who knows, they'll be looking to cut that back. And of course, as well as COVID continuing to be prevalent, in the workplace and in our care homes and the NHS, we're seeing, cases of psychosis have risen by 29% since April 2019. Over 1 million people are using food banks. Our NHS is at breaking point. And our further education sector is being brutalised, and at the same time there isn't really any effective political opposition to what's going on. So it's down to the trade unions, it's down to us to fight for safer workplaces, and our strength obviously lies in the power of the collective. And as well as fighting to improve safety in our own workplaces, I think that we're seeing a number of disputes arising across the country. I think it's important that we provide support and solidarity to all workers who are taking action at the moment, and we really, through our collective solidarity and through our efforts to make sure that no one is left behind, no one is thrown under a bus, that we break through the issue of mass alienation that has been created by the COVID pandemic and by years of Tory austerity, that then we can look to, support each other in our communities, that we can unite together, coordinate and take the necessary action that's going to be needed to improve our workplaces for the long term, not just at the moment. So thanks for having me, Janice, and always a pleasure to talk at the to be involved in the Hazards campaign, who have played a fantastic role throughout all of this. So cheers.
Oh, thank you very much, Trace. That was excellent. And I think Hilda put in the chat, about educate, agitate and organise. And that is what we're doing, isn't it? And that's, when we're doing that, then we're certainly making an impact. And it is about, I think it's been really interesting, hasn't it, throughout the pandemic, that we started with hardly anybody understanding what health and safety was about. And, we've been going on about it for years, about it being a good organising tool that, most of us in our workplaces, where there's a health and safety issue, it's an organising issue. And, it hasn't been taken up in that way, but I think it's been shown through the pandemic how important health and safety is, and how people get behind it, and how we can use it to unite workers. But it is also about educating workers about what's important in it. The SRSC regs, as you quite rightly mentioned, it is essential, and you and James mentioned, that is essential that we know that and what's in there and what we can use, how we can use it. And quite rightly, you've all talked about the legislation and the fact that not only is the government tried to undermine it throughout the pandemic by bringing out useless guidance that doesn't meet health and safety law standards, but also we haven't had it enforced either by the health and safety executive of the local authority health and safety officers. So it is down to trade unionism. But when we think that less than 50% of workers are in organised trade unions, that's a hell of a lot of work that we need to do to one, protect all workers, but two, to show the significance of trade unions. We're going to open it out to some questions and discussion, and please indicate if you can using the electronic hand that's in reactions, I think on the bottom of the screen. I have posted, by the way, just while you're thinking about questions or anything you want to say, there's a conference coming up in March called Invisible Killers that will be circulating about information about it. It's about things like asbestos and in schools, it's in education, asbestos, about the pandemic, etc. But also there's we've got a COP26 event taking place on November the 8th that we haven't got the final details yet. We're hoping to get them before the end of the week, and we will circulate those as well. And we'd love you to join us at that. Anyway, so without further ado, Zoe, do you want to unmute yourself?
Hello, everybody. It's been lovely to hear from Hilda. She's been a real inspiration throughout this whole pandemic, so that's great. A big fan. But I'd just like to say to everybody, please keep being vigilant. We're the same. We've gone throughout all this pandemic, making sure that our members are protected. And we're just in the latest fight now of getting 2 care workers who are approaching 28 weeks pregnant to be medically suspended on full pay and to work from home. And the fight and the arguments that you have to do just to get these ladies safe and protected, it's just like going back 18 months again. Nothing's been learned, nothing's changed, and we've just got to keep fighting.
Thank you so much, Zoe. Whereabouts are you working?
I work, my accent doesn't give it away, I work for Cornwall Council. So we're down here, and we have set up the groups and they do listen to us. But even with the guidelines and the HSE guidance behind us, we still have to fight for everything. But just keep it up, it's worth it.
Fantastic. Thank you so much, and thank you for joining us. Does anybody else wants to make a statement or ask a question? Yes, Carol.
Thanks, Janet. I think the comments that you said earlier on are completely true. I mean, health and safety used to be the bit that the anoraks wanted to do. And it was quite often referred to, or you can handle it, it's health and safety. And then suddenly, even though you're doing the same stuff, but you're doing more of it, it's got a different profile, and far more people are interested in safety, and people who would never, ever get involved in any of the safety meetings are suddenly involved, and it really has a high profile. It's been really hard work throughout the pandemic. I mean, we first wrote to management in February 2020, when it was obvious that COVID was going to come to the UK and that we should start putting things in place. But our department didn't do anything until the Prime Minister said they could. And I feel like I've been in constant fights every single week since the middle of March. And we've had to fight on every policy. I mean, James mentioned all the things that he's managed to do. I'm pleased to say we've managed to get most of that for the whole of the DWP. And at the beginning, we did have 6 members die, which was absolutely tragic. But after that, we managed to get 90% of our members working from home. And that was a real battle, getting the department to produce kits so they could do the job and they could prove they did the job. And they actually did more cases of things like universal credit than in unprecedented numbers as more and more people became unemployed and went on to furlough. The numbers that they cleared from home were unbelievable. And yet, from July, they have been forced back into the workplace, especially in the job centres. And we've got, I think it's about 800 offices, from small job centres of 20 to 30 people and large service centres up to 3,000 or 4,000 people. Most of the service centres are still working from home, but it's the job centres that the department have insisted have been back in the office because they say they can't do the job, even though they prove they can do the job remotely. And they're forcing customers, some with severe disabilities, to go into offices that we don't believe are COVID safe. And it's a real battle. And every time the Prime Minister and the government decide to amend the legislation, we have to start another round of fights and another round of risk assessments. We do have risk assessments in every single building that we have. And we have them for everything that's being done. But management keep trying to change it. And on the ventilation issue, Mandy mentioned in chat about the zero COVID thing that Hilda spoke in, which was really useful. We had estates managers telling us that all our buildings met the met the ventilation regulations when they were built. And we had to say, but that wasn't in COVID times. Some of our buildings are really old and the legislation wasn't that good, although they did amend them in 2012 when legislation changed, but that's still too long ago and didn't reflect COVID. So we're having a real battle about ventilation, and we're really grateful for the stuff that Hazards told us, because as we said, we do need more training for reps, and we're having to become experts in things that we didn't have a clue about. And with Hazards and the stuff they've been saying is where we're getting a lot of our information. And I was really grateful for that zero COVID meeting, because I had a meeting on ventilation on the Friday with management and could actually have a row from a point of strength, quoting some of the things Hilda said. So I'd like to say thank you for that. Keep up the good work, and thank God all the reps are out there doing it.
Fantastic. Thanks. Brilliant. Thanks, Carol. That's brilliant. And really good to hear that that you've been able to use the information that Hilda's provided. You know, and I think that's, you know, it's information is power, isn't it? And it gives us the ability to be able to challenge some of these employers who absolutely do not know the information. They don't have the experience, they don't have the training, and certainly not as capable as the reps are. I'll bring Mark in and then I'll bring Kat in. Mark?
Yeah, sorry, I was pushing the wrong button. Listening to all of that stuff, like, we all have here probably experienced similar things. I work for BT and I'm CW Health and Safety Coordinator for the Southwest region. And I think I listen to all of this stuff here, and I certainly can say that I've had to deal with similar, but also at the same time, I think in some ways we have in the company have experienced something slightly better, although they're insisting that people start going back into the offices, but it is on a very slow basis. It's not going everybody's having to go in, and that didn't really start until the 1st of October. We do have some sites where we've had people all the time, like the 999 services and stuff in the call centres. They can only work from those environments. And like a lot of people said, some of them are old buildings with, when they were put in, the ventilation was good, but I'm not so sure they're good now. But I think the key thing is, and quite a few people mentioned, is we've got agreed risk assessments with BT Group that says we will do this for this type of building, we do this for this type of building, and each time a new building's occupied or the levels increased, they're meant to work with the local union reps, union safety reps, to go through the risk assessment and make sure. Now, I would say that's where it falls over. You have people at the very top think it's going wonderfully well because they believe everything. But I think on the ground, you certainly have managers that feel that they don't need to follow that process, and they rush people back in, they pressure people, they pressure in them to sharing vehicles and all of this sort of stuff. And I think it's something that, despite the fact that we might have great risk assessments, I think the practical delivery of it, and the fact that you've got several thousand members and 20 or 30 union safety reps to try and police all of that and get out there and follow it all up is a challenge. And I suspect many of you all feeling the same, that you might have some good stuff in place, but you just don't have the resources to go out and make sure it's applied appropriately. And managers try obviously to get around it and not necessarily have to spend the time or the resource to sort it out. But I think we just got to keep pushing and doing our best to make sure we get there. And I suspect we'll be all working from home again, the rate it's all going, though with Mr. Javid obviously feeling that a few 100,000 cases and 300 deaths in 2 days is something that we can live with. Well, it's not in my book.
Thanks, Mark. And I think that shows how important it is to keep being vigilant in the work that we're doing. We might end up at home again, and really we shouldn't be returning to work while the transmission rates were so high. But I know your union has done a fabulous job in trying to protect the members and to keep them safe, and to put pressure on them to stop infections. So thanks for sharing that. Kat.
I don't want to take much time, so I'll be as quick as possible, but I just wanted to touch on what Carol brought up, Mark touched on, and Tracy touched on, which is fatigue and burnout. And I think particularly fatigue and burnout, if you're a health and safety rep, we're all in 850 WhatsApp groups. We've all been reading government legislation, trying to catch up with it, trying to interpret it, trying to communicate that out, trying to respond to our employers. And it's probably taken me the entirety of this pandemic till now to start to consistently exercise healthy boundaries, but it's so hard. And I can't tell you what the answers are, but I can tell you what I've learned has helped me is to recognize what we've carried, all of us, and the people that we represent. I don't mean us especially, I mean all of us as activists and trade unionists, that we have carried a lot, and we are allowed to take a breath and say, I'm knackered, and actually, can I call you tomorrow? Is it urgent? And how to draw those boundaries with fierce solidarity. But that's been one of the things I've found the hardest to learn. And again, I don't have the answers, but I suspect we're all going through that on some level. And I hope that we can not be ashamed or embarrassed to talk about it.
I think that's a really important point, because this has been tremendously difficult, especially for reps who are working in the workplace, who've been working all the way through the pandemic as well. That this is a massive burden that you've carried, And, you know, I think absolutely right what you say, Kat. You know, we have to recognise that and to find a way of managing it properly so we're all safe, because we want to wake up tomorrow and we want to help other people, don't we? And if the pressure's too great, then, you know, you'll end up with people burnt out and walking away, and we can't afford that because of your experience and your knowledge and your, you know, the skills that you've achieved throughout the pandemic. Mandy and then Helen.
Hi, I just wondered what yourself and Hilda's view was on people now being asked to return to the workplace at this point in time in the winter, to hybrid work when they're quite able to do their job from home, especially when it comes to devolved governments where both well, Carol in Wales and myself in Scotland, it clearly states by our governments that if you can work from home, you should be working from home. And I just wonder what your views are on that. I think I'm going to try and push it down the ventilation side of things, because I don't think management really understand, as far as numbers are concerned, that it's ventilation and not how many desks you've got or whether you've got a canteen. And I want to break it down room to room, basically, within the office. And I just wondering what your view is on people being dragged back at this time of the year when it's the cases are through the roof and it's winter and winter bugs are coming in. What's your views on that?
Okay, thanks, Mandy, and I'll bring Hilda in a minute. But, you know, obviously our risk assessments haven't changed. You know, you need to look at the risk assessments as they are, and in my view that they haven't changed, but I'm sure Hilda expand on that a lot more. Helen and then Darren.
Thank you. It's been a very useful and helpful refresher for me tonight, and to hear Hilda speaking made me really pause and think about some of the things that I've been doing in the last week. So as somebody that's been working from home since March 2020 and has only gone into the university to do health and safety inspections or put up posters for our ballot and distribute leaflets, it's come to my attention that our UCU regional officials are being told to remain at home. And so that brought the question to me then, should we as activists be going into the university? To be honest, I didn't even give it another thought. We're also planning a number of health and safety inspections. We bought about 6 between the 2 trade unions, CO2 monitors, and you know, our colleagues are back in university. And if I wasn't 3 days a week working for the trade union, I'd be back in teaching in the classroom in front of students. As it happens, I've not had to do that. So I just thought that was quite an interesting thing, and it really made me think about, you know, what we should be saying to members. And you know, we know that the best control is not to go into work. And the big issue, of course, is that, thank you to your speaker about talking about using public transport, because we're actually putting others at risk when we're doing that as well as ourselves. It's very clear to me, anecdotally, from people I know around me, that double jab people are coming down left, right and centre with COVID. But yet not necessarily, we pray and hope that they're going to be hospitalised, but maybe they would have been if it was a year ago. So, you know, we're kind of in one place or another. But I'd also like to hear from wonderful comrades what you think we should do if we are successful in our ballot. Should we be picketing? And I know that's probably a little bit off beam and what a, you know, a kind of a strange question when we're trying to protect the people who are workers in work and who I represent. So I don't want to be precious or special compared to them, but I may well be leading people to go and stand in the freezing cold at 7 o'clock in the morning. And should we be doing that, Hilda? I think I know what Hilda's going to say. So, you know, I kind of think, although I sit in a health and safety committee every week, and I think about it all the time, I think I've been led astray in my head. And as somebody said, we kind of want it to be over. So we You know what I mean? So it's helped me to reset today, and I'd really like your advice. Thank you.
You're on mute, Janet.
It's because I was coughing. I thought I'll stop myself coughing. Yeah, sorry, I was going to bring Hilda in and then bring Darren in.
I think that's a very, very good point, Helen and Mandy and other people who've spoken, is that I think we've also been lured along this way, and those of us who've been shouting and fighting the hardest, as all of you have been for a very long time, you get worn out by it, and you are worn down, and Kat has spoken about that. And the fighting again uphill, the thought of doing it all again. So there is a huge move, even in ourselves who know all we know, to think, oh well, we can go along with this. It mustn't be quite as bad as yet. There's cognitive dissonance. We know it's really dreadful, but the narrative out there, but from the government, from the press, is that it isn't, and that's actually very, very, very difficult. And I think scenes at the Labour Party conference and scenes of union leaders talking to people in meetings without masks has been very bad and very damaging and very undermining. I think it is very difficult. We do want to get out there. We do want to do picketing. We do want to go in and put up posters. And what I would say is that you use the same method that you'd use for anything and do a risk assessment. And the thing to do, if you're meeting outside, obviously outside is safer. That's definitely true. But you still need to distance outside. There are reports, quite well documented reports, particularly where there's lots of good CCTV, where people have picked up the Delta variant from very transient exposures outside. So I would say wear PPE, definitely. So wear FFP3 mask yourself to protect yourself, and try to avoid things like, if you're going picketing, try to avoid public transport, or get there on your own. Make sure that people are distant. Still make sure what we were doing a long time ago when we first started having outdoor meetings, still keep up the distancing and wear the masks when you're speaking or talking or singing. I think we have to do this. We have to protect ourselves and we have to protect others. That's really what I would say to that. Outdoors is definitely better, but it's not the right thing to do. And the comment on working from home, yeah, you've got working from home is still the thing to do. That is still what the risk assessment and the control hierarchy tells us, and we have to keep going back to it. So much of our work as safety reps is fighting the same battle over and over again, the broken record technique, having to challenge them. It's still true. The science hasn't changed. The law hasn't changed. And we have to, we just need to be supported and reinforced in that. And we have to keep on using that. Working from home, if people can work from home, that's really what they should be doing. That will protect themselves, it'll protect others, it'll protect everybody else on public transport who has to go to work because they can't work from home. It will protect our families, and it will, prevent the utter social and economic deprivation that we've got at the moment, disruption that we've got at the moment from the government's endless COVID and herd immunity plan. So all of those sorts of things. Thank you, Hilda. Darren.
Hello. First of all, I'd like to thank John Cobden for inviting me to this particular thing. Thank you, John, much appreciated. It's opened my eyes a lot, to be perfectly honest with you. I think I was falling along the same sort of lines that, oh, it looks like this is actually going away. I recently went up on a break with my wife, first one we've had in quite a long time, up to Scotland. And on the way up there, we stopped at Preston, where I've got family, and went into a shop to pick up a pair of trainers, and we went into Aldi's and things like that. And there wasn't a single person wearing a mask. None of the staff, none of the people that were in there. The queues were all lined up as it was before. And I was actually getting under the impression myself that, okay, it's not going away, but this vaccine is really curing this. This is going to be a great thing. I have a friend who works at Bristol University who knows somebody who is very au fait with this stuff, and I spoke to him before I came onto this, and I was talking, I was there, we're going to go and look at this and have a feel and see how things are going now, because the government are saying things are getting better and what have you. And the first thing he said to me, he says, you need to take the blinkers off, son. He said, you need to take the blinkers off. He says, this ain't going away. He said, it's getting worse. I lost in the first round of COVID. I have a large family throughout the world, Australia, Italy, Spain, what have you. I lost 21 members of my family to COVID and 2 to suicide. And they almost lost me in December. My wife works for a company. She looks after kids who've been abused in the worst possible way. I can't even say the words. But her boss came into work to tell everyone that she'd just tested positive for COVID without a mask on, and spoke to my wife directly in front of her, gave my wife COVID. My wife came home, and I'm disabled and I have asthma and other problems. And of course I ended up with it. And through that and stress at work and everything, I had a 2 days before Christmas, I had an oxygen level of 83. According to the paramedics, I should have been dead. I've still got the bruises, some of the bruises on my chest. So even though I went through that, I was literally under the impression that this was getting better. So today has opened my eyes, and I can't thank John enough for inviting me, because I'm going to be going to, well, I'm actually going to, when I go into work tomorrow, I work for HMRC, I'm going to ask for a meeting with the staff there, because they are obviously under the same impression. They have now allowed 8 people in a lift at any one time. They will still only allow 1 person into the toilets, but they'll allow 8 people into the lift at any one time. And the toilets are 10 times the size of a lift. I'm going to be asking some very serious questions. So I'd like to thank everyone for everything they had to say today. And as I said, John, for inviting me, much appreciated.
Thank you, Darren, and thank you for making that contribution. You know, and we're really sorry to hear that from your experience from over the pandemic. There are hundreds of thousands of people that are experiencing similar things, and you know, this is the tragedy of it all, isn't it? That it could have been prevented, and people didn't need to be put in that position. And we've got a government that's absolutely negligent from the top down. I mean, you only need to see the pictures in the Parliament where they're exposing not only their comrades in their parties, but also the workers that work there. And they're saying that it's not going to get infected because they're friends. I mean, what an absolute bizarre and ridiculous statement for them to make. And you know, and the consequences are that, you know, lots of people are experiencing the sort of heartache that you're experiencing. And I'm sorry that you've had it, but it's really good that you've come. And, you know, and we have to start changing people's minds to what's actually happening. So I'll bring James in first. Thank you, Darren.
Janet, I'm happy to let Hilda go before me, because I think Hilda might have been responding to Darren directly, because I was going to pick up on something earlier. So if Hilda wanted to respond to Darren, I'm okay to come back.
Thank you, James. That's very perceptive of you. I don't quite know how I communicated that. I think Janet and other people have said in the chat, our hearts go out to you, Darren. That's an absolutely terrible thing. But as Janet has said, it's happened to many other people. I think what I would just say is we do have to regain our voices and actually, you know, our solidarity in telling people the truth, telling it as it is. And what I would just say, a word of positiveness, is that although the vaccines have not been very good at preventing people from getting the illness and carrying on transmitting it, there's a glimmer of hope in that the boosters, the Pfizer boosters, appear from the tests to be very effective, 95% effective at actually preventing infection. Now, this is a really positive thing for the future, and it might be an angle that we could all use, in that we have to prevent transmission now and protect that rollout of the boosters. So we're saying something slightly different, something slightly more positive, which is what we should have done with the vaccination generally. That we need to protect the rollout of the boosters in, let's get them as fast as possible, but by preventing transmission now to stop undermining that.
Thanks, Hilda. I'm going to bring James in, and then Ian, and then Tracy to finish, if that's okay. So James.
Thanks, Janet. Mine was a point in responding to the question about picket lines, and I think what we need to be careful of is that we don't stop our organising and we don't stop our campaigning and collective bargaining. It's just that we might need to do it in a slightly different way, because we are going through rounds at the moment of industrial action ballots, Unison being one of them. And I think there are a number of things that employers try and hide behind. It'll be the trade union legislation 1 minute, for example. I think they don't believe we will reach our 50% turnout, and I hope that we can stick it to them, and we do turn that out, and we are doing everything we can within our power to get that turnout and to force that action. But they can't also hide behind, and I'm talking about people within our own union as well, by the way, who may not want us to be taking action, and I'm not going to get into who's or whoever, but it can't be seen as an excuse to do nothing, is what I'm trying to say. And that picketing can be done. Hilda's right. Risk assess it. It's outside. You keep your social distancing. And really, you'd like to think that you wouldn't be coming very close to anybody if you're doing things right and you're organising correctly. But we just can't be put off organising this way, because we need to be ready. But we just maybe need to think differently about how we do it. And I should have mentioned before as well, just very quickly, on the social media, thanks to the Hazards campaign, in terms of their intervention during the self-isolation policy dispute that I was having earlier on in the year, that it was one of their helpful comments that pushed the balance over as well in our favour in terms of our argument, and the information that they produced has been, again, invaluable. So thanks to the Hazard campaign for that as well. Cheers.
Thanks, James. And we produced an outside risk assessment for some of the protests that have been going on. So, it is important that we just, use the established way that we assess risks. And that's, the same for any risk, whether it's on a picket line or on an outside space. When we've got people from our organisation that go visiting really vulnerable people. So we've been looking at the risk assessments and seeing how it can be done safely for both the workers and the people that they're visiting. And it can be done. This infection in a workplace is just a normal risk. There's no difference in normal times. So we just need to make sure it's done properly and rigorously. Ian.
Thanks, Janet, and thanks to everybody that's attended tonight, because I'm a great believer that learning from hazards and learning from everybody else and that our health and safety reps is the best way of educating each other. I've got to say as well that hazards have done a fantastic job, and all the way through this pandemic, if not before it, and I've certainly stepped in where the HSE regulator should have been. We had in Edinburgh, I'm the health and safety officer for Unison in Edinburgh, and we had problems even before the lockdown came in, because we only had 4 corporate health and safety advisors out of 11, and we had a contractor basically running that team. We had to draft in our environmental health team to assist, and they had issues of their own with compressed hours and part-time workers and everything. And I've got to say that our health and safety reps on site did an absolutely fantastic and vital job. Unfortunately, what we're now seeing is a burnout, and a lot of the reps have now decided that it's time to have a rest and stepping back. And we're not getting new people through, and that's kind of putting the pressure on just to keep up the momentum and what we've been doing all the way through this. But I just wanted to give people a bit of encouragement, because with the help of hazards, and particularly Hilda, and the work that you've done on HEPA, as you know, I put forward a pilot that I suggested within schools to retain the safety measures that we've got, along with CO2 monitors. And I also wanted HEPA units put in classes so we could monitor these. And I found out today from our head of education that they are in fact going to go ahead with pilots with HEPA units in some of the schools. So, you know, if it hadn't been for hazards, that probably wouldn't have happened, because we've been able to communicate, we've been able to put pressure on the employer, and we've came up with ideas that they previously hadn't thought about, and we've also passed that on to some of the politicians as well. So it's just a case of, you know, there is complacency setting in, there's no doubt about that. In Edinburgh, it's only 3 or 4 weeks ago that the World Health Organization recognised that our transmission rates were one of the highest in Europe. So we can't let the pressure, we've got to continually pressure the employers and just keep all safety and mitigating factors in the workplace. I'll leave it at that, Janet. Thanks.
Thanks, Ian. And I know you've done an absolutely brilliant job up in Edinburgh, trying to hold your employers to account and to make sure that people are safe. You know, and I think, you know, you recognise, I think we all recognise, it's through events like this that we can share information, that we can know that we're part of a movement and not just on our own back in our workplaces, and how important that is, to have that unity, that strength from that unity, from other unions, from other health and safety reps. So yeah, thanks for sharing that, Ian.
Well, can I just say as well, obviously I occasionally send you some information about the transmission rates in schools, and as of tonight, since the start of term on the 16th of August 2021 in Edinburgh, we've had over 4,170 positive cases. That's more than we had from August last year to the start of the summer holidays this year. So it tells you there is a real issue within schools in early years.
Yeah, thanks, Ian. Hilda, do you want to just come in? Are you replying to something, or is your hand just still up? Your hand's still up.
It's still up, just ignore me.
Okay, just going to bring in Tracy. I know we're over time, so I just wanted to make sure that everybody had spoken. Thank you.
Yeah, oh, well, thanks. I mean, that was they call it a legacy hand, don't they? I've noticed as the lingo for the hand being up before. Well, thanks very much. I mean, I really enjoyed the discussion tonight. We've kind of taken a little break from having our regular safety meetings for the very issue that Kat described. We're all a bit knackered, but we're going to get them back up and running again. And it's reminded me of how useful it is to just, you know, discuss with other reps. And I do think that there is some merit in us, you know, taking forward the idea of some sort of, you know, building on from this. To try and get some sort of regional, you know, local sort of networks of trade union health and safety reps together on an ongoing basis, because, you know, for the umpteenth time in a row, you know, the TUC safety rep survey has shown that stress is the #1 issue facing safety reps. So that, you know, there is a lot of work to do to kind of, you know, support the work that safety reps do on the ground. That often I get reps will call me up just to vent, you know, just to sort of say, you know, moan at me, you know, and I do it to other people as well. I have colleagues that I ring up when I'm frustrated, and I phone up and I vent, and that's what, you know, I think things like that are, you know, can't be underestimated. The other thing really as well is that, of course, we don't have a proper track and trace system in this country, hence why, you know, it baffles me that they can't work out, you know, to this day about where, you know, infections are and why they can't do that. And we know the answer to that. So I think that that's something that needs to be looked at, as well as all the other points that colleagues have raised as well. And don't forget as well, at the start of the pandemic, you know, the government's narrative was to blame the actions of individuals. It's people breaking rules. We saw that at the DVLA. They tried to blame the staff, didn't take any responsibility for the fact that that workplace was a breeding ground. So, you know, we can see, you know, where the government comes from, and that's why, you know, obviously the trade unions play a key role in countering that narrative. And then the final thing, I just wanted to plug the new Independent Sage initiative that's been launched, which is called Scores on Doors. And what it is that they are proposing that there is a certification scheme is introduced in this country, and it's going to be similar to energy colour coding, where in order to gain certification for indoor spaces, a specialist has to look at a room, has to view it, has to work out what measures are in place. Does it have air conditioning? Does it have HEPA filters? And that room is then graded. And I think that I would urge everyone to have a look at that in terms of an initiative, and it's really aiming to put forward the issue of ventilation in a non-technical way. Obviously, it has a campaign of producing fantastic resources which we've utilised in PCS. But I think, I will be putting forward the proposal that PCS supports the Scores on the Doors initiative by the Independent Sage, and I would urge you all to have a look at that. But thanks for inviting me, and thanks for the discussion. It's been fantastic.
Thank you, Tracy. That's a great reminder. So thank you all for joining us tonight, and thank you so much to our speakers who've been I hope you agree, have been inspirational. I mean, the information that they provide is invaluable, but it shows what we can do when we're organised and we are working together. And I think, remind you again, you're twice as safe in a trade union organised workplace, so we've got to keep organised. We've got to get people into unions. We need that unity across different trade unions. We need to be recruiting more members, but more reps, and we will organise then to save lives. And as we always say in the hazards movement, we will remember with heartache all our dead, but we will fight like hell for the living. So thank you very much.